Hey everybody, my name is Justin Novak, and I'm going to talk about what is like, or what are the expectations to be an EMT for you, brand new EMTs or people looking at going into EMT school. All right, I'm going to give you some of my background. My name is Justin Novak. I've been an EMT for 14 years, and so I've been doing this. I got my certification since 2005, and I basically enjoy my job. Um, so, for you people who are looking getting into EMT school or in EMT school or fresh out, um, got your certifications, want to be an EMT, I'll give you what my experience are and the expectations. Um, I am an FTO. I'm a field training officer for the company that I work for. I train new employees, especially EMT basic, since I'm an EMT basic. Um, so this job is is hard work. If you're looking at getting into this job to be a with for money purposes wise, or you get to see really cool calls, and I'm an EMT, I'm a first responder. Okay, being the EMT, you're not going to get paid as much. Sorry, that is a fact. Um, so uh, when you start out, your pay is not going to be what you expect it to be. When I first started out as an EMT basic back in working full time for a company, I was starting pay was 8.50 an hour, and so throughout the years, my pay has increased and it fluctuated depending on what company you work for. The highest paid was $15. Lowest pay was about $8. Um, so if you're looking at this, oh, I'm going to make some money in this, not off right at the bat. Um, you can make some money if you want to, if you want to work a lot of overtime. This job does require a lot of overtime, if sometimes. Um, so that's the only way you're going to make a lot of money. You're going to work long hours. Sometimes you're going to get held over of work. It happens. Sorry. I mean, if you're working a 24-hour shift and your relief decides to call off at the last minute and they can't find somebody to cover that shift, sorry, but you're going to get held over. Um, it's part of the job. I mean, that's what it is. You're going to be away from your family quite often. Um, so those are two main aspects of what it's like to starting out in the EMS field. Um, Also, this job, if you're looking at for the glory, for the cool calls, sorry, that's not what it's really like. Yes, TV portrays that a lot, but it doesn't really happen. Sometimes it does. You get some really good calls. Sometimes it's like, are you? Oh well, why'd you call me out? Um, don't get me wrong. I do love my job. I've been doing it for 14 years. This year is going to be my 15th year of having my certification. Um, so I love my job. Uh, when you're starting out, of course, once you get your certification, in the state of Texas, where I am from, you have to take a national registry exam. You got to pass that first. Then you will get then you get your state certification. Texas only requires you to only hold your state certification. So if you don't want to have your national registry, let it go. You don't have to worry about it. As long as you keep your state certification up, you're good to go. Um, so uh, that's what it comes down to. EMT school lasts about between 3 to 5 months, I'm guessing. You got classwork, you got hospital rotations, you got your write outs, um, you got to do your national registry skills. So you have to do that all during the EMT school. Um, it's supposed to kind of get you out and experience, you know, talking to people, getting used to assessing them, taking their vital signs. Um, Once you get your EMT certification, you're looking for a job again. Um, there's two ways to go about it of getting it. There's for type of jobs. A lot of times, there's non-emergency transfer EMS services, or there is uh, private EMS 911 service, or of course, you go the fire department route. Um, so if you're looking at just saying, if you're looking at just wanting to do EMS, you're not interested in fire, you like EMS, that's all you want to do. Cool. Um, for me personally, I started out in private EMS. So what we did was we did a lot of dialysis transfers. So we would go to nursing homes, pick up patients who are unable to sit up in a wheelchair, take them by ambulance, and transport them to a dialysis center. Or sometimes we'll take a patient to a doctor's appointment. Um, or sometimes the other type of call is, you have a contract with a nursing home. They're sending a patient out to the ER. I call them ER calls. Um, Take them out there, and excuse me. So um, take them to the ER. Basically, it's kind of like a 911 call, but it's not life or death. A lot of times, you get called out for person's labs values were abnormal. Maybe their liver enzymes were elevated or low, or their creatinine, BU and creatinine, those are your kidney function levels, if they're abnormal. Um, so, they'll send them out to the ER to get checked out, or, sometimes patients have a G tube and sometimes they rep them out. You take them to the ER for them to put it back in. Uh, I, Sometimes you might get a chest pain call or you get a fall. A lot of it's a fall. Um, so those calls are, and sometimes you might get something really good. Um, when I started out that, it allowed me to hone my skills. It's the first company I worked for. We had to do manual blood pressures on every patient. We didn't have automatic blood pressure cuffs at all. Um, we did a lot of manual blood pressures. It literally, honed my skills on taking the blood pressure. Also, it's a little slower pace, so it allows you to, get to talk to the patient. Ask them questions. Are you hurting? Are you, um, you know, are you feeling? You know, Plus, you can look at their medical history. It's on their face sheet a lot of times, and you take their medications list with you. You can compare to, the medications. Look at what medications they're on, and trying to see what kind of medical history that they have. For instance, a lot of beta block drugs, they end with LOL, carvedilol, metoprolol, stuff like that. Those are beta blockers. And beta blockers too is they block the beta receptor, which try to lower the pulse rate. In return, it lowers your blood pressure. That's a beta blocker. Or, if a patient is on warfarin, Coumadin, blood thinners, they might uh, have AFib. And, you got to be cautious about those patients. To the fact of, if they bumped their head and they fell, they might have an internal bleeding. So it's a really cool, way to learn. Um, at least you get some experience working. You might get to work with another basic, or you get paired up with a paramedic. It allows you to practice your skills, honing your skills, doing patient assessments, you know, asking questions, do a full head to toe exam on somebody. Um, Nothing wrong with starting out there. Maybe work there for a couple of years, and if you want to try to go into a 911 system, apply. Um, because I give you by my experience, I'm an FTO by trade, where I work. So I train new employees. A lot of times they're brand new EMTs come directly out of EMT school that just got their certification. Um, I work in a rural county type 911 system. A lot of times, where I'm stationed at, or way out in the county. So it's just me and my partner. We do have volunteer firefighters. Some departments do have first responder status, which means they will respond to medical calls, but they're volunteers. So that means they might show up, some don't, some do. It just depends. Um, a lot of those guys are not even EMTs. They might not even be ECAs, emergency care attendants. Um, they probably don't even have a CPR card certified. Not even that. They join the fire department to fight fires. Is what they want to do. But they also have first responder status, so they are supposed to show up on medical calls. They have like a little medical bag that they carry with them. Um, Sometimes they show up, sometimes they don't. If they do, it's great. If we need the manpower, need the help to lift or whatever, um, especially on CPRs, we do. It takes a lot of people to run CPR. Um, but a lot of times you're out in the county, you get maybe a multiple vehicle accident in VCs. Um, your partner might be dealing with one patient, leaving you up to the other patient, and you got to be confident in your skills of doing patient assessments. Make sure you do a proper head to toe assessment. Check everything. Do a rapid assessment. Try to notice any major life threatening injuries. And once we determine our triage, if we got multiple victims, then the person that's most critical, load them up, and make sure you got good trauma shears on you, because trauma calls, if you get hurt, things are cutting off. Sorry, you spent $50 on a shirt, $100 on a pair of pants. They're getting cut. Sorry. Um, so I'm very big when I'm training my new employees. I'm very big about patient assessments. Know your patient assessment. Um, Also, uh, a lot of companies, you have to take a protocol test, knowing your actual protocols of, for your skill level. And because, the whole idea is that your protocols where you don't have to look in the book each time you're on a call. You already know what you need to do for that patient, the treatment that's already outlined for you by your medical director. Um, Know your drug dosages. I mean, know, what's your epi drug dosage for allergic reaction? You know, EpiPen. You know, EpiPens are cost a lot of money now these days. So a lot of times they're teaching the EMTs how to draw it up out of the vial. You know, how much? Don't know how much you draw. What is the dosage that you're drawing up? Um, so make sure you know your drug dosages. Um, oh, adult and pediatric. Um, so being an EMT, part of this job is you're going to work a lot of long hours, not great enough pay, and you're going to be away from your family. A lot of times, thankless job. Um, I didn't get into it because I want to be a hero. I got into it because I like my job. You have to go into something that's different each time. You never know what's going to happen. I mean, I can give you an example. I got toned out for difficulty breathing, turned out to be a stroke. Wholly two different separate situation and of calls. You know, you're getting your mind prepared for, okay, difficulty breathing. So what are we going to do for this patient? You know, O2 sats, check the vital signs, you know, listen to their lung sounds, stuff like that. But as soon as we get on scene, nope, wrong. That changed to a stroke protocol. Okay, so this guy is actively stroking, has been less than 4 hours, still within the 4 hour range. This guy needs to get to a proper stroke center and where they can get, they have neuro, they got TPA, they got everything, you know. So things change. Then instead of working a yellow call in triage, green, yellow, red, we're in a yellow call, which literally switched to a red very fast. So our speed jumped up a lot of getting this guy out, having to call a helicopter in, fly this guy out, trying to get everything, get IV set up, get everything set up that we need to be done for this guy, prepared for the helicopter. Um, Plus, this job requires people to be able to want to talk to people, talk to them. Don't be shy. Ask them questions. You might get some rudeness out of them, but you know what? I'm sorry. That's how they feel, but it is part of our job. You need to tell us what's wrong. It's like when you go to the doctor, you got to tell the doctor what's wrong so he can fix you. Well, we are the extension of a doctor. You need to tell us what's wrong so we can fix you. Well, you have to ask questions. People are not going to just freely tell you. Okay, talk to them, ask them questions. You know, what's your name? What's your birthday? Do you have any allergies to any medications? Um, you have any medical history? You have high blood pressure. A lot of times I get patients like, well, I take a medication for that. So, well, if you take a medication for blood pressure, you have high blood pressure. It's being controlled by medication. If you don't take your medication and you don't, then you still have high blood pressure. You know, you have any heart problems, high blood pressure. Have you had any heart attacks, congestive heart failure, you know, heart problems, okay. If you had any strokes, seizures, any brain issues, any problems with your lungs, asthma, COPD, emphysema, pulmonary edema, you know, thyroid issues, any problems with your liver, gallbladder, pancreas, kidney, stuff like that. Ask them. Try to dumb it down for a lot of people because they don't really know. They don't know all these medical terms like we do. Ask them, have you ever had a cerebral vascular accident or a CVA? People don't know what a CVA is. you had a stroke? Ask them that. So, EMS, it is a great field if you love things, handle high stress, um, want to go into different situations, trying to control chaos, basically. That's what it is. Plus, I always like to use the motto what the Marine Corps does: improvise, adapt, overcome. Because sometimes you have to improvise of how to use certain things, adapt to the situation that's happening, and overcome it. You know, you got somebody stuck. Well, you got to improvise. Well, how am I going to get this person out of there? Adapt to the situation and overcome the situation. So, to me, I believe EMS kind of falls into that because we have to do a lot of stuff to help them to be better, make them feel better. Um, so, if you're looking into becoming an EMT, want to go through EMT school, more power for you. Just remember, a lot of times the company that you're going to go work for, they're not going to pay as much just because you're brand new. I got 14 years experience. You think I'd be making at least 20 bucks, 15 bucks an hour? No, make 11 bucks an hour, roughly. So, I mean, as time goes on, more experience you become, more pay you get. Also, if you're looking at going from directly from EMT school into paramedic school, in my opinion, I don't like that idea. The reason why is, what experience do you have on honing your basic skills? Do you know how to bandage somebody? You know how to splint something? Do you know how to take a manual blood pressure? Do you even know how to talk to somebody besides doing it since they're watching over your shoulder? Are you able to do that with somebody else watching over your shoulder? Doing it by yourself? No. Talk to them. Ask them. This, work a couple of years, 2 years tops, get some experience in. Plus, my opinion is, as well, at least this will give you're not you spending maybe what, $1,000 for EMT school. Paramedic school is probably 3 grand to 4 grand. A lot of time, a lot of investment. You get that patch and you're working and you realize, actually, this is not for me. I don't want to do this job. It's too stressful, too much work. Well, you just spent invested over maybe 5 to 6 grand into this job field. That money could have gone towards something that you actually want to enjoy doing, your business or whatever. But remember, you can handle blood, you can handle walking into the most foulest stench of your life. Fine. Because trust me, I walked in some pretty nasty places. Some of them are nursing homes. You'd be surprised. Um, because I've been in places where as soon as I walk into a nursing home, I get that stench, urine, and I walked into a patient's room. There were roaches everywhere. There was ants crawling up the walls of in people's houses. There was roaches everywhere, all over the kitchen. It was just nasty. But that was my job. I have to go in there and go help them. That's part of our job. Um, will take a mental toll on you. Uh, I've ran on some gnarly calls, ran on some sad calls. It happens. It's part of the job. Um, just remember, this job is something that you're willing to do. I mean, Plus it gives you a good experience of starting out and see what actual medicine is like. Of experience the whole entire field. You got from pediatrics, adults, geriatrics, childbirth, trauma, you name it, you experience it all. Death, stuff like that. That's what happens. So that is my take expectation so far as being an EMT. Also, to be in the to work as an EMT, my job when I get on a truck, I'll make sure you got to check off the truck every time you come on a shift. Make sure it's fully stocked. You got to do a full inventory list of the whole entire truck. You have to do check the fluids of the truck, check the siren, make sure that works. Make sure your radios work. Make sure all your equipment works. Make sure your monitor has proper battery time on it. Um, Make sure you have plenty of oxygen on board as well. That's part of our jobs as well. Doing a full check off inventory, washing the truck, taking care of your station because you live there. You're there. Me, 24-hour shift, I live there every third day of the week as my home. And that's part of it. I'm out there being part of, trying to serve the community. So, just remember, you're going to spend a lot of time away from your family, friends. You're going to work holidays. You're going to work your birthdays, work family's birthdays. Going to miss special events. Sorry, that's part of the job. I mean, doctors, nurses, all deal with the same thing. We have to do it. That's part of our job. Just remember that. So, all I can say is welcome. I hope you become better EMT or the best EMT you could possibly be. And welcome to EMS. God bless you. Hope you have a great future in it. Progress into possibly paramedics, maybe become a nurse or a doctor. Who knows? There's so much progression in the medical field as well. Well, have a great day. Please check out my feed. My name is Justin Novak. You can find me on JustinMan18. Um, and thank you again. Please like, comment, share this post to people who are looking into becoming an EMT. Remember, EMT for 14 years, um, about to be 15. So this is my career. This is my profession. So I'll have a great day.